Hi, everyone, and welcome back to the Flint Community Webinar. This is our last webinar of the year, so we're going to be wishing you a wonderful holiday season and a wonderful new year. And to kick us off with all of the things about the new year, we're going to be talking a little bit about mental health and all of the things we need to think about as we start to set ourselves up for a wonderful new year and think about what it's going to be like to do all of those things we're going to be doing, talking to family, and what all of those feelings can kind of kick up for us. So we've got some wonderful people to help lead that discussion and talk about community mental health resources. We've got my colleague in our McLaren and Family Medicine office, Dr. Erin O'Connor, and Carrie Chanter, who's always a wonderful colleague and a wonderful guest who comes back all the time, is awesome expertise with Genesee Health Systems. And as usual, we have the wonderful Nurse T and Doc G here with us for expertise. We're going to talk to a few other experts. Before we get into all of that, it felt important to talk to you all a little bit about something we read in the news in the Flint Journal just a couple of days ago about a drug-resistant fungus spreading in Michigan hospitals. And this felt important for us to think about. And we just reached right out to our wonderful Dr. Caitlin Lara, who's going to talk to us a little bit about why we should not be so worried about this. So go ahead, Dr. Ruff. Thank you so much for being here.
Yeah, absolutely. Happy to discuss. We'll talk more about this next week, but I just wanted to give you guys a heads up because I know a headline like this can feel very alarming. It always seems like there's something new to worry about. What they're talking about is a yeast called Candida auris. So on all of our bodies, we have lots of bacteria, we have yeast, and they're just kind of sitting there and they're not bad. They're just present. They help, keep us from, the balance of them helps keep us from getting certain infections. And that's a good thing. However, if we get any cut in the skin or end up on a ventilator or get a feeding tube or something like that, we become at risk for infection from these bacteria or yeast. And Candida auris is a yeast, and it is new, relatively new, I should say, to the United States, although it's been here for several years. But it does not always cause infection. And so this headline is a little bit misleading because there have been about 2,500 cases or so of colonization where it's been just found on people's skin. And that is not the same as an infection or an issue with one of these bacteria or fungi. And I also just want to say that it does have the potential to develop drug resistance, but over 99% of these organisms are treatable with an agent that we do have. So I just want to reassure you this isn't a catastrophic end of times sort of situation, but it is something that we'll talk about next week. And I'm always happy to take questions about these sorts of things. So thank you guys so much. And I'll mute myself, but we'll talk more next week. Thank you.
No, I super appreciate you for giving us that context and kind of settling us down a little bit around this. And it's not going to be next week. It's actually going to be next year, right? Right.
Right. Next year. Yes. Thank you.
So January 9th we'll be coming back and we'll get to talk a little bit about what all of that stuff means. But it was important that you heard from one of our people with expertise that this isn't something we need to worry about now, especially as we head into the new year. So thank you so much for sharing your expertise there. All right. We are here with some of our amazing expertise. And this request is actually at the request of the community. We have had community members reach out and ask us to talk a little bit more about what are the health resources in the community that we can use, particularly as we go into a time of year that can be a little difficult for some people. And here to talk about that is one of my favorite people in the world, Dr. O'Connor, who shares a wonderful wealth of expertise and has just so much expertise as she talks to us about this topic. So thank you, Erin, Dr. O'Connor, for being here today.
Thank you so much. Just checking to make sure my screen is looking okay.
Yep.
Wonderful. So yeah, Hi, everyone. Thank you so much for the opportunity to join this amazing webinar with these fantastic people and really to talk about something that I'm incredibly passionate about, which is mental health. So for today's webinar purposes, I'm going to be talking a bit about mental health resources, specifically those at McLaren, since that's where I work. So briefly, just a little bit about me. I am a clinical health psychologist. I specialize in comorbid physical and mental health conditions in older adults. I am the director of several training programs here at McLaren, including our MAP program, which I will talk a little bit about. It includes a fellowship and an internship program in health psychology. I'm also the director of our behavioral program and our family medicine residency program here at McLaren, and I'm the MSU psychiatry clerkship director for Flint. So I have worked for McLaren, for MSU, and in Flint for almost 15 years now, which I cannot believe, but here we are. So that's just a little bit about me. So my agenda for today is to share a little bit about who we are at McLaren. I'm going to be talking about our McLaren Academic Health Psychology programs, and I'll define a little bit about what that is, who we are, what we do, what we specialize in, and how to contact us. If you're interested or you know someone who might benefit from services, how to get a hold of us. So, health really is not absence of disease. It really is a holistic state of balance. And so the mind and the body are two really big pieces of that balance, and they're all connected. So one affects the other. So it's really, really important that we give time and energy and attention to both the physical health, but also mental health, because really good health is real wealth. And so this is some of the background and the philosophy of the field that I work in, which is health psychology. So who are we? We at McLaren Academic Health Psychology Programs, we are a group of faculty, fellows, and practicum students. We currently have 4 fully licensed clinical psychologists who are our faculty with specialty training in health psychology. We also have 4 postdoctoral fellows. What are postdoctoral fellows? These are recent graduates, those that have just recently graduated from a doctoral program with a PhD or a PsyD in psychology, and they're obtaining specialty training in health psychology. We are a 2-year accredited fellowship program. And so all of our fellows are going through this specialized training, and they're supervised by us faculty. We also have practicum students. So who are practicum students? They are folks that are still in their doctoral programs. They're completing their coursework, they're obtaining some clinical hours, they're working on those really scary dissertations. And so they're here on site with us, obtaining clinical hours, learning, training, and they are supervised by both the fellows and the faculty. So all in all, at least currently, we have 10 providers, so 10 psychologists who specialize in mental health, and in particular, mental health and kind of the connection between physical health and mental health. And that makes up our McLaren Academic Health Psychology program here at McLaren Flint. So what do we do? A lot. So for the purposes of today's webinar, I'm going to focus on our clinical work and our outpatient work. But we do a lot of other things in terms of teaching and research and other roles that we play. But I'm going to focus on our clinical services in the outpatient setting. So one big thing that we do is psychotherapy. So this is meeting with an individual provider, anywhere from 30 minutes to 60 minutes, really identifying struggles, symptoms, things that have been challenging, and setting some treatment goals, and then learning tools and techniques to promote optimal health. How do we help you be your best self? So that's a little bit about the psychotherapy that we offer here. We also do assessment. So we're all trained and qualified to do psychological assessment, and that can be a variety of things. What we do with assessment is, again, we identify symptoms. Sometimes we get diagnostic clarity and trying to kind of figure out what's happening, what's going on, why are some things more challenging or more of a struggle. We really look at understanding your strengths and how do we help you maximize those, and then maybe identify some growth areas, maybe areas of change or areas of struggle that you'd like some extra support around. And we link folks to resources, and that could be maybe a referral to a therapist. It could be a a support group. It could be, connection with other community resources, but we would certainly help with that. In addition to those outpatient services, we also run several integrated clinics here at McLaren Flint. So we run an integrated primary care clinic. What this means is all of our providers here in our outpatient family medicine and internal medicine residency programs, as they're seeing patients in clinic, if there is a mental health need or a behavioral health need, one of either myself or a member of my team is available to go and meet with that patient right then and there at the time of their appointment. So really breaking down those barriers of like trying to schedule an extra appointment, trying to get to another office, all of those things that make, getting to appointments really challenging. We try to break down those barriers and just kind of catch patients here and now when they're available, and work together on again, treating kind of the whole person. So not only your physical health needs, but your mental health needs as well. In addition to that integrated primary care clinic that we offer here, we have a geriatric assessment clinic. Now, this is a much more kind of intensive, deep dive into, what's going on. We tend to meet with older adults, typically ages 65 and older, but that's not a hard and fast rule. And we do a comprehensive assessment of our older adults. This typically includes things like memory concerns or memory changes. We do some testing of memory and cognition. We definitely screen and test for mood symptoms. We do some things like medication management and other general health kind of questions and concerns. But this is also something that's available. We partner with our geriatricians here who are just the experts in older adults and aging. And we work together as a collaborative team to, again, treat that whole person, come up with some strategies that help our patients stay safe, happy, healthy, and as independent as is safely possible. And then another integrated clinic that we have that's a little bit newer to us, so we're quite excited about it, is the lifestyle medicine clinic here. This involves, again, more of an intensive kind of deep dive into lifestyle modification and behavior change. And so we have patients join us. This is in a group format, but it is live and in person. And we really focus on what we believe are kind of the main pillars of a healthy lifestyle. That's things like sleep, physical activity, nutrition, stress management, avoiding harmful substances, and those kinds of things. So it's another really integrated clinic. We work with our physicians on this as well, and patients get access to a really comprehensive care tailored to your individual needs. So that's quite exciting as well. And then finally, our very, very newest program that we're really excited to get off the ground, it hasn't even started yet, but we are looking for folks interested, is a parenting group called Mom Power. This is something that we've partnered with the University of Michigan Department of Psychiatry on. It is a evidence-based parenting group really aimed at kind of fostering strong and supportive connections between moms and kids. So this is going to be run virtually. So again, no worries about trying to get to a location. That can be really challenging, especially for moms. And so if you have access to a phone or a computer and you can kind of click a link, you can access this group. And we are looking for individuals who are interested in participating. So that's a little bit about what we do. What we specialize in, again, is really thinking about health psychology. So health psychology is that connection between physical and mental health. So we work a lot with individuals who are coping with chronic illness. Again, having a chronic illness is stressful. There's a lot to it. It often involves a lot of lifestyle change and adjustment. And so we really help individuals navigate kind of the physical and emotional components of diagnoses, of any changes that need to happen, things like living a life with diabetes, hypertension, COPD, those kinds of things. We also work with a lot of patients who are adjusting to new diagnoses. Getting a new diagnosis can be scary, it can be stressful, it can be a lot of questions and kind of not really knowing where to go. And so we really help folks navigate that. We provide support and strategies. Our goal is to really help you maximize your quality of life. And that can be, in numerous conditions, but things like cancer, congestive heart failure, and stage renal disease and stroke. We really try to work with patients on like, how do you find value and meaning in your life and get that quality of life aligned with your values. Lifestyle and behavioral medicine, again, we really want to help folks take steps to move towards a lifestyle that's greater aligned with values. That might mean something like quitting smoking or achieving a healthy weight or maybe improving sleep. But those are some things that we would work with individuals on. And this is our bread and butter in health psychology. These are the things that we're really passionate about, really highly trained to do, experts in the field on. Now, that doesn't mean that we can't also see folks who are struggling with depression, anxiety, trauma, and those kinds of things. We are all also really well trained in those areas and happy to see individuals who want some support around those things. But in terms of our true specialties, health psychology, these are some of those things. All right, so if any of this sounds interesting, sounds helpful, is something that you or someone who would want to get involved in, I've got some helpful contact information. Now, the good thing about this is that most of us are all kind of in the same location, same contact information. So they're just kind of different clinics within the same physical site. So for our McLaren Academic Health Psychology Program outpatient services, we do have a suite within the medical education building here on Beecher Road. So we're in the suite 1. I've got our phone number here and I've got our website as well. This is more kind of geared towards our programming and our training, but just in case you're curious about the training that our fellows receive, a little bit more on our faculty, you can access the website there. If you're interested in more of our integrated care clinics, integrated primary care, geriatric assessment, lifestyle medicine, again, we're going to be in that same location off of Beecher Road in the family medicine and internal medicine residency clinics. Same phone number, we share a front desk. So you can use that same phone number and just say, hey, I'm really interested in getting someone scheduled for a geriatric assessment. We'd be happy to help you out there. I've linked our family medicine clinic website there as well. You can see a more comprehensive list of all of the services our clinic provides. And then if you're interested in Mom Power, which I really hope you are, someone who is, because we're really excited to get this going. This again is a virtual online format. So there's no physical location of this, but you can give my colleague, Dr. Kimberly Miller, a call. Her and I are going to be the facilitators of the group. I've listed her office phone number. Give her a call. She'd be happy to chat with you more about how to get started, answer any questions. And I've linked to the Mom Power website here. This is the Zero to Thrive website through University of Michigan to give you more background on Mom Power, again, the philosophy, how it's structured, and maybe fill you in on some other details. With that being said, I wanted to mention a few more McLaren-specific mental health resources. These are sites and programs that myself and my colleagues aren't personally involved in. We don't provide services at these sites, but I know very well the individuals that do, the mental health providers that do, and I can speak very highly and confidently of their expertise. I would strongly recommend them. So if you are interested in additional services within Flint, I would recommend the Outpatient Behavioral Health Clinic at McLaren Oakbridge. They also provide psychotherapy and assessment sessions. I've got the address there. They're over off of Linden Road on Oakbridge Drive. Got the phone number there as well. McLaren also has a partial hospitalization program, which is an intensive outpatient or day treatment program. And we have group programming for both adolescents and adults. So if you're looking for more intensive services, this is a phenomenal program. Again, I know the providers very well, and I definitely really advocate that folks access that programming. And then for those that are in need of even more intensive services, McLaren Flint does have an inpatient behavioral health unit. So this is located in McLaren Flint in the hospital, and this is really for psychiatric emergencies, those that are really in need of acute intensive treatment. I've got our address there, and I've got our phone number to contact in case you or someone you know is in need of that support as well. So that being said, I just wanted to thank you all again. I am happy to answer any questions. I've listed my contact information here, and would absolutely be happy to answer any questions or connect you with any additional services. So thank you again for your time today. I appreciate
Thank you
it.
so much. Full disclosure to people, I have the honor and privilege of getting to work with Erin in the office and see sort of all of this wonderful work in real time, which is really cool. I wonder if you would explain a few things for us and like break down what it means. So if we think about psychotherapy, what does that look like for patients? Like what happens in a visit? What types of questions might we ask?
That's such a fantastic question. I'm so glad you asked that because there's a lot of mystery around psychotherapy, I think. A lot of people, you just don't know much about it. It feels very mysterious. And in fact, it's not. It truly is. In your first session, you would meet with your provider and you'd share a little bit about your life. So they'd probably have a lot of questions for you in your first session just to get to know you, ask about, your support system, ask about your stressors, really try to get a sense of you as like a whole person. But from there, you really collaborate with your provider on setting shared goals. So they might ask you again, like, what are your goals? What do you want to work on? What's bothering you most? What is something that you want to work on or change? And you'd set some goals together, and they would then probably provide you with some information on ways that they could help. In psychotherapy, kind of the cool thing is we have a lot of different tools and different approaches. And so we might offer a menu and say, you know what, you're really struggling with depression. There's a couple of different approaches we can take. We can take a CBT approach, cognitive behavioral therapy. We can take an ACT approach, acceptance and commitment therapy. We can take a DBT approach, dialectical behavioral therapy. These are all different ways that we treat mental health conditions like depression and anxiety. They're all fantastic, but one doesn't work well for one person, you try a different one. So usually there's a lot of education that goes into like, here's the approaches that we can take, here's some of the things we can do. And we really let the patient drive the decisions. It's really, up to them what they think would be most helpful. And then we probably, again, try out different techniques and strategies. We talk about how it worked or how it didn't work, and lots of support. I think that's the real basis of psychotherapy is someone in your corner, someone to support you, somewhere to go and get all of this off of your chest and really talk through like, how do I navigate this? So
That's
those
such
are
a
just some
wonderful framing.
ideas.
Yeah, no, thank you so much for that. I wonder, I know, I don't want you, I don't think you have to give like specific details of how DBT and CBT work, but I do wonder if you'd give like a cursory overview, because I think we are in a place where there are apps that like help people with CBT and things like that. And I wonder if you give some context of what that is and how people use it and what's the basics of like what people should understand about CBT.
Yes, absolutely. Love this. So, yeah, lots of different approaches. They just kind of take a little bit of a different like approach in philosophy. So, cognitive behavioral therapy is what I'll kind of focus on mainly because this is our most evidence-based intervention for conditions like depression and anxiety. So, typically when somebody comes to our office and say, I'm really struggling with depression or anxiety, my first thought is, I wonder if CBT would be helpful. So, what CBT involves is this philosophy, this idea that we have thoughts or cognitions, behaviors, and emotions or moods, and they're all connected. And if we can change one of those, we can in fact affect change in the others. And so for CBT, we focus on either thoughts or cognitions or behaviors, and we say, let's try to make some changes here. If it's thoughts and cognitions we want to focus on, for example, in depression, we might focus on what are some thoughts that you have when you wake up in the morning? What are you aware of? Maybe it's like, oh God, it's Monday. Like today's gonna be terrible. Oh, it's so cold outside. Oh, I'm exhausted. If those are the thoughts that we have when we start our day, how are we likely to kind of feel? Well, not really super motivated. Maybe we press snooze a couple of times, and those are some behaviors, right? I'm not motivated, therefore I press snooze a couple times. Then I'm late to work. Then my boss yells at me, and then I feel even worse. And it's this spiral. And so, if we can change those thoughts and say, you know what, maybe if you notice that you're having those negative thoughts, we call them in the morning, what if you tried reframing that and saying, oh, it's a new week. It's a new chance to kind of start on the right foot or something. So if we change our thoughts even slightly, that can start to change our feelings, which can affect our behaviors. That's the big kind of like piece with CBT. Some people find it difficult to focus on thoughts. It's hard to change our thoughts, right? They feel very automatic. Sometimes they feel out of our control. So sometimes we focus on behaviors and say, regardless of the thoughts you're having, no press and snooze. We're going to take snooze off the table. It's not a thing. Or what we call behavioral activation. When we're depressed, we do less. We're going to challenge you to do more. So you got to get out of the house, go for that walk, make a phone call to a loved one. We're going to change our behaviors. And if we change our behaviors, we tend to feel a little bit different. If we feel a little different, maybe our thoughts are a little different. Like, hey, I'm feeling a little better. Hey, I have a little bit more energy. Hey, I'm kind of looking forward to tomorrow. And so they're all connected. We just kind of decide which one we want to target.
I feel like we all just got a free like a free therapy session. Even that, I definitely pressed snooze this morning. I think that's why I was feeling that. I do see a comment really quickly from one of our community members. I saw Kay. Really quickly, I'm gonna summarize this, and she says, Dr. O'Connor, I experienced the sudden death of my son 1 year ago. I had difficulty finding a therapist who could address traumatic grief. Thankfully, I was sent to a therapist in Clarkston, and I'm so thankful to be receiving excellent care. I discovered that several church and community grief groups do not have training or understanding to appropriately address grief. There is so much loss and grief in the Flint area. Is grief counseling addressed by your team? And first, I want to say thank you so much for being willing to be vulnerable and share that. I think it is the reality of so many people who are afraid to share their personal stories. So thank you for one, sharing that story with us. And two, thank you for asking the question. And so Dr. O'Connor, please.
Yes, absolutely. I just want to echo that. Thank you so much for the question. I'm terribly sorry for your loss. Absolutely, that grief, loss, trauma are all things that all of our providers are fully trained and qualified, and absolutely would be willing to help and assist with. I think you're right, Dr. EJ, that grief and trauma and loss is just something our community in Flint unfortunately experiences so much of. So absolutely, we would be open to seeing anyone who would struggle with that. And I also wanted to highlight the comment that not all providers are trained equally or have that same expertise. You're right. So support groups can be really lovely and helpful. You do want to be mindful of who's facilitating those groups, right? What is their training and background? And it's not, one size fits all. And so if you are seeking, more expert, support, absolutely, I think you did the right thing in trying to find a therapist specializing in that. Absolutely.
Thank you so much. I want to make sure that we don't let Dr. O'Connor go anywhere, but I'm going to talk to Carrie Chanter for a little bit. And it's so great to have this conversation because I have been in the office where we have, thought, okay, what's the best resource for this patient? Oh, we're going to use Genesee Health System's mental health urgent care. We're going to use this. This is the best resource. And in the conversation where we're talking about how do we best support our community, there's no better place to have a conversation or no better person to help us think about what are the resources we can provide for students than Erin and Carrie. So Carrie, thank you so much for being here. You're always like a welcome guest and you always have so much expertise. So thank you for being here and thank you for your expertise. And just maybe talk to us a little bit about the mental health resources that you all have and anything that you thought might be a good follow-up to what Dr. O'Connor shared.
I learn something from Dr. O'Connor every time I hear her.
Same.
Yeah, the geriatric assessment is what's sticking with me the most because that's most pertinent to my life right now because I'm a caretaker of a mother who's going through some mental health crises. And I will tell you for the first time personally, I've had to navigate the system. And so it is hard. It is hard to navigate what's out there. And unless it's applied to you, you've never maybe even thought of it. And then you're thinking of it. And all of a sudden you're like, what do I do? And that's coming from somebody who works here. So I'm just letting you know that just stick with it. We're so lucky in this county. I'm going to be talking. My name is Carrie Chanter. I've spoken several times on this webinar. It's such a great thing for our community to have. Big kudos to you guys for keeping this going. I'm going to talk about crisis services through GHS. I think, I just assume that people all know that we have a BHUC and some other services through GHS, but I think it's important to remind ourselves, and this is a great time to do that. And I know on our agenda, we're going to be talking about how this time for most people creates a whole lot of, can create anxiety, stress, good and bad, and can really be a trigger for many. So it's really important to walk into this holiday season knowing what's available to you and if you could help support a family member, friend, coworker, all that. So what I'd like to do first is share just a quick 1.5-minute video, if I can. Yes, I can. And it kind of just goes over, it was actually a really nice news piece that was shared through WNEM. No, I'm sorry, it's 25 Fox 66. So I'm going to go ahead and share this quick 1.5-minute video. It shows some nice shots of our new space, and I want people to feel really comfortable going there. So Dr. EJ, if you can't hear this or if
Health crisis is now open in
We can
Genesee
hear it.
County.
Perfect.
Network is celebrating the launch of its new behavioral health facility in Flint. And Michigan Now's Andrea Flores tells us more about what this facility has to offer.
From early intervention to after-hours access, the new behavioral health facility is a major step forward in addressing mental health care needs, especially during off hours when help is hardest to find.
Well, we've been dreaming of this for a long time.
Now, that dream has become a reality, a state-of-the-art facility that will provide those experiencing a mental health crisis a place to get help that is much nicer than a jail.
If you've ever had a crisis at 2 a.m. or you've had a loved one or a family member that's had a mental health crisis, you really had no options.
Especially after 6 p.m. Dr. Michael Yagi with Hurley Medical Center calls the new facility a game changer.
These types of services are really unheard of, and the idea that you can avert and mitigate a behavioral health crisis without going to the hospital is really a key part of the service that they're going to provide here.
Comfortable rooms to sleep in, very nice common spaces for family visitors, and a well-trained staff to help guide those in crisis through recovery.
Knowing that this is here should give everybody a little better peace of mind that you're not going to end up in the hospital, you're not going to end up in the sheriff's just because you had a bad mental health day.
Dr. Yagi says it's important not to wait until a crisis happens to take action. He says that's what the New Hope Network facility on Beecher Road is all about. They can intervene early and try to avoid the crisis from even happening. In the studio, Andrea Flores with Michigan Now.
Okay, so thanks for indulging me, letting you see some of the indoor spaces. I was trying to figure out some way to show it to you without taking too long. So that was good.
Carrie, can I highlight why that video was also so helpful? I mean, we've had Dr. O'Connor from McLaren, we heard from Mike Yagi at Hurley, right? And we've got GHS. It really illustrates the extent to which our community works together. And it struck me. I was listening to Mike talk and I was listening to like Dan talk and we know all of these people and they're accessible in some way. And
right.
I love the ability to make them accessible to community. So thank you for sharing that video.
Oh, well, good. I'm glad. I hope it wasn't too boring for people.
No, it was perfect.
So that you know, if you're familiar with the Flint area, we are in the old Baker College campus. So, and the BHUC, or sometimes you'll hear people call it the BHUC. That's not my personal favorite, but people call it the BHUC or the BHUC, Behavioral Health Urgent Care. Not every county has that. I think there's only 5 counties in Michigan. So we're really lucky to have one. And so I want to go ahead and share some of my slides that kind of reiterate, what we're here talking about. Basically the goal of that BHUC, first of all, I'll get to that in a minute. So the goal, you guys, is to reduce unnecessary visits to the ED, sitting in the ER, for hours on end. Not that all ERs are like that, but sometimes, if you're in a trauma center or something, some other people have to go before you. So that wait can be a little bit longer. We're trying to decrease inpatient psychiatric admissions. We're trying to decrease people drop, like cops, not blaming all cops, but some law enforcement may drop them off at the hospital or the jail. And so a lot of the jail calls can and do include a mental health component. And so we have been training our law enforcement and first responders here for 2 to 3 different years. We've had a lot of people go through the program. I think every single municipality has been represented to make sure that the law enforcement has more of a mental health side. We also have a co-response team that goes out on several different calls. Obviously not all of them, but many. But the goal of the BHUC is to provide like this emergency mental health support 24/7, 365. Just like Dan said, like these emergencies never happen when they're supposed to, right? They're always on a weekend, a holiday, after midnight. And so basically that's kind of our goal with the BHUC, and try to fill some of those gaps in the community. You saw some of the pictures in the video, but this is kind of what the entrance looks like. It's actually on the very back of our building, so it's not actually facing the street. It has more of a private entrance than our main entrance. This is not the main entrance. It has a bay that ambulances could potentially drop off, or law enforcement, or like I took my mother. I was going to share my personal story about 2 months ago. My mom had some drastic behavior changes. And after being taken off of mental health medicine, and we were in absolute crisis. And guess what? I got to, for the first time, experience that on the other side of it as a consumer of services. And I watched my little old mother up up the ramp. There's a ramp on the side, and I got to experience it firsthand. And I almost acted like a secret shopper because we have so many employees, like they don't know who I am, not all of them. So I didn't even tell them who I was because I was just trying to figure out what the experience was. And it was really, really important care that we got at the time, and I had nothing bad to say at all. It was a really great experience. So this is meant to be accessible 24/7, and I'm going to talk a little bit about what that virtual piece looks like if it's super off hours. You can walk in Monday through Friday 8 to 10:30, Saturday and Sunday 8 to 8:30. But if it's after hours, we certainly are reachable by phone and by text, and they can set up telehealth pretty quickly, usually, depending on who we have on staff. So 24 virtual services available for sure with a licensed mental health professional. I already talked about the walk-in hours. We are opening this 24/7 in the very beginning of the new year. So it won't be kind of fragmented. This will just be open 24/7 starting in the new year. So we're really excited about that. This is open to all insurances, regardless of your ability to pay. Medicaid, Medicare, private insurance, uninsured, with no cost. If they like to say, if your foot is in Genesee County, we will serve you. So, I was really worried about my mom's insurances. She's got Medicare, but then she's got this commercial, and they all figured it out. They helped navigate that whole thing. So that was really helpful. So what happens when you go in there? And that is something that I felt like I needed to tell my mom what she's going to experience when she walks in, because that was scary for her, right? She's like, what am I going to see? What is this going to be like? So I showed her pictures. It's very comfortable. It's very private. And they're very, very professional there. So what do you do when you get there? Basically, they're going to do a screening and an assessment to see what sort of level of care that you really is best for you. They do have psychiatric services, prescribers, peer support services, people that have been through this before. We have case management, obviously. But like a little bit, let's say they come in and they need a higher level of care. We have the ability right there to authorize for services for something a little bit more intensive, like a crisis stabilization or intensive crisis stabilization unit, partial hospitalization program, crisis residential, or inpatient. So if you come there and your needs are greater than just coming in, having that one visit, stabilizing you, and it really needs more, that's okay. We can authorize and we can get you there and help you make that decision. So on average, why do people usually access the BHUC? It could be anybody in a crisis, right? It doesn't have to just be suicidal thoughts. It can be depression that might not be managed. My mother's was intense anxiety, fear, panic. Sometimes people even start at the BHUC if they want to start their substance use journey, their substance use treatment journey. They can always start there. Children and families who are having a hard time managing behaviors. Maybe you have some disturbing thoughts, and maybe you just don't know how to access the mental health system. And you're like, you know what? I'm going to walk in and they're going to help me. So just know that we are there for that. So that's the BHUC, but I do want to mention a couple other things that I think would be probably really helpful for people to understand. We have what's called a CRU, and that is open. What is a CRU? It's a crisis residential unit, and it's basically a short term, and the whole focus is to stabilize people. It's very short term. We have 8 beds. It's beautiful down there. I just was in there. People can stay up to 2 weeks, but on average, they're there from usually 3 to 5 days, and it's a voluntary program, but short term, and it's basically an alternative for somebody who might qualify for psychiatric hospitalization. So that might be another alternative. It's like it's very safe inside. Everything from the doorknobs to the water fountains, the bathrooms, everything is very safety oriented, and it feels like home. So it feels very comfortable. So that's good. Basically, our job is to try to stabilize people and then be able to help them with their skill building and then in recovery once they leave. And so while people are there, they're going to help with medication management, how to cope, connection to ongoing services once they're out of there. So that is all part of the services that they would receive. Now, that's the CRU that is open. That's the same entrance as the BHUC. However, we also have a CSU. So a CSU is the Crisis Stabilization Unit, and that is opening in January. I think we've actually just got the final approval. And if we could open before the new year, we would, but I do believe it's that first few days of January, we're going to be opening the CSU. Now that is 16 beds, and people stay for about 3 days, up to 72 hours. And that's for people that are in crisis or emergencies. Again, safe, voluntary. The whole goal is for stabilization, or to not have to necessarily go into an inpatient psych unit. Again, minor medical needs could be managed on site for people. So we're really excited to get that open. And honestly, it was a huge investment from the state, from MDHHS. We're only going to be the third CSU in the state of Michigan. So again, Genesee County, we're really lucky to have some of these really innovative things going on in regards to mental health. So super excited about that. Then the last thing I wanted to mention, actually the last 2 slides. So do we have mobile? So let's say you don't want to go to the BHUC, you don't want to walk in, but you want someone to come to you. We have contracted with a 24/7 mobile crisis team. And so during business hours, obviously it's our team, but we have contracted with a very reliable third party that does provide that mobile crisis team support. And it's basically, you call the same numbers as the BHUC, say, hey, I've got this going on. I'm experiencing a mental health crisis, and teams are dispatched usually within an hour, like trained clinicians that come on site, do the assessment, de-escalate, try to get you back stabilized. And basically what that does is reduce the need to maybe call 911 or to go into the hospital, where you might be able to manage it outside the hospital. But again, these professionals that come out, they're super trauma informed, person centered. They are very experienced clinicians. So I heard really great things. I have a friend who actually had to use it on a kid who locked himself in his bedroom. And she called, and they had somebody there probably in 45 minutes. The clinician was able to get the kid to unlock the door, and they were able to be stabilized, and he was able to go to school the next day. And then it was basically some follow-up treatment was, like we don't just let them go. Usually it's, hey, calling the next day saying, hey, did you get hooked up with some outpatient or whatever that assessment showed when they were there. So that's that mobile crisis team that will respond anywhere in Genesee County. When a kiddo it might be at school. So when it's at school, it's called UCare. We have MOUs with almost every single school district in our county. And what that allows us to do is, if the front desk staff have a kiddo that they cannot get back in that classroom, it cannot get stabilized, they've tried everything that they have tried, sometimes they just need a new face. And they can always call us. We come out there within 60 minutes, and we're doing all of the things that we would do in office, but we're doing it on site with the parents' permission, of course. And that's what happens like during a school day. So, all right. One thing I want to remind you of is we do have a new a crisis text line. So basically you're texting GHS to "We Got You" or that 934 number. And then you'll be able to text back with a licensed therapist, which is a really nice resource to have. And don't ever forget, we also have 988, which is that national suicide, basically lifeline. It's that old 800 number, but now it's 988. All right, who's got questions? Anybody have questions?
There are questions. Harry, I wonder for you, what is the biggest misconception or concern question that you get that you would want to dispel for community, that you would want to answer for community around accessing kind of mental health resources? Sometimes there can be stigma, and I wonder if there's some misconceptions or things you'd like to address.
Yeah, thank you so much for bringing up stigma, because that seems to be the biggest barrier why people ever go actually get help, whether it's mental health or substance use related. Stigma is probably the largest barrier for people. I am so amazed by our staff every single day and how compassionate they are, and how, like, you are treated just like everybody else here. And I can tell you that because I just went through as the secret shopper, right? But now they all know. I will tell you that I'm so impressed, like I said, every day. So the biggest thing is you're not going to be treated like there's something wrong with you here. In fact, we're proud of you for taking the step to get help. Too many times people live in the shadows of not getting help, and that hurts a lot of people. So if you could just take care of yourself, it helps others too. So I think the biggest thing is don't be ashamed by getting help. That is the biggest thing, the best thing that you can do for yourself, and you're not going to be treated poorly here.
Thank you so much for saying that. And it's very clear in the way you talk about the program, because it just, any of us could have one of our worst days. Any of us could have a mental health challenge. Any of us
yeah.
have something that we have to navigate or have difficulty or have a challenge with. And the compassion for that is just so valuable. I do want to I want to bring Erin forward, and I want to start thinking a little bit about how we have conversations around managing holiday stress. But really quick, before we even get into the holiday, both of you mentioned something that I wonder if you talk a little bit about related to a geriatric assessment. And I want to make sure people understand what that is, what it looks like, what it means for the resources you have at Genesee Health Systems, and what it means for the resources that Dr. O'Connor has within our own clinic. So if we could spotlight Erin too, and just everyone be in the conversation, it would be amazing.
Erin, would you mind talking about in general what the geriatric assessment is? Because from the GHS side, my understanding is that we have a very standardized set of tools and screeners that we use, right? And my guess is that they are probably using something that is adaptable to the geriatric population. But my guess is that you guys are using the most validated tool. So I'd be curious to see what you say.
Yeah, absolutely. Yeah, for us in our geriatric assessment clinic, again, some of the core features are we partner with our geriatricians, so our physicians who are board certified in geriatric medicine. So they really specialize in the older adult and everything that comes with aging and all of that. And so we have our geriatrician present, we have our behavioral health provider present, and usually some learners in there as well. And it's a comprehensive assessment. So we meet with a patient and a loved one, a family member, a neighbor, whoever is also able to provide us with some information on how patient is doing and maybe some struggles. We do a very thorough kind of gathering of information on, again, like what's going well, what's not going so well. What does physical health look like? What does mental health look like? And we do that through interview and asking questions, but we also do it through validated assessment measures. We, again, primarily, the main kind of concern that folks come to our clinic for is like memory and memory changes. And so we do memory testing. So we will use things to assess kind of current domains of memory and other domains of cognitive functioning, things like attention and spatial and some of those other domains. And we really take a look at like what is happening kind of here and now today. We compare that to, as best we can to maybe kind of baseline or what was happening a year or 5 years ago. And we come up with a plan. And really that's the goal of our assessment clinic, is to do a thorough assessment of what's going on and come up with some treatment recommendations. And that's usually a pretty long list. It might be medication changes. Sometimes with older adults, they end up getting put on a lot of medications. It's just add, and never take away. So our geriatricians are really good at doing what we call medication reconciliation, where they go through all of those medications and they say, why are you taking this? Is it helping? Is it not helping? Are you having adverse effects from it? Is there maybe something that's occurring because you're on these two different medications? They don't play well together. So we do a lot of medication reconciliation there. They do a physical exam and take a look at things like hearing and vision, balance and gait or walking, and other physical health conditions. Like they might get lab work done and say like, how's your thyroid functioning right now? How is that A1C with your diabetes management? And they might make some recommendations on there. My team, again, is really focused on mental health, behavioral health. So we might look and say, you know what, you're scoring pretty high on the depression screen. I wonder if that's perhaps impacting memory, because we do know that depression can, especially in older adults, look a lot like memory changes and even dementia. And in fact, if we treat the depression, memory improves. So we might say, you know what, we really think we need to get you into some treatment for that depression. And then let's reassess your memory and your thinking after that's a bit, better managed. I wonder if we'll see a change. So those are some of the ways that we work with patients.
the primary care doc in me is like, oh my gosh, these are my favorite people. This is exactly what we need to be thinking about, right? Because Erin, you alluded to the idea that so many, you know, things that can go on relative to mental health, fatigue, depression, anxiety, they show up differently as we age, right? And so we're often, you know, we might be running after labs as clinicians, or we might think, oh, we need to tweak this, but so often the answer is we need to take away, we need to assess for things like depression or anxiety or dementia. So I so appreciate you bringing to context that geriatric assessment. Go ahead, Carrie. Sorry.
Well, and I was just going to say, Erin, that's so helpful to know. And like, that seems super thorough. So like, I'm looking at the GHS side as being somewhat of the emergency crisis part of that. But once people are stabilized and could potentially do that geriatric assessment, and meet, are you calling them what did you call them?
Geriatricians.
Geriatricians.
Yes.
Okay, sorry, I was thinking I was saying it wrong. So geriatricians, the fact that they will look line by line those medicines is so important. So yeah, thank you for explaining that portion. So that's a little bit more specialized, I believe, than what we're doing. But again, we're more of the crisis emergency side, and then yeah, people could also do that as well. So, and that's actually where I'm at right now with my mom, is they have thought, well, okay, maybe this is early dementia, but then another doctor saying, you know what, this could be unmanaged anxiety and depression. So we're trying to tinker, and that is exactly what it feels like, is tinkering.
Yeah. Thank you so much also, Carrie, for sharing those personal stories, because I think it does help people understand, like, these are things we all are going to have to navigate, whether for ourselves, our loved ones, and particularly as we head into the holidays, these are things we're going to be thinking about, right? We're going to see our loved ones, we're going to be hugging, we're going to be thinking about, oh, what are the resources we might need to help our loved ones with. So I appreciate so much this conversation. I want you to talk with us a little bit about why this time of year can be so stressful for people, and why it's so important that we're thoughtful about strategies to manage the stress.
My initial thought is, everyone thinks about the holidays being so joyful for everyone on TV and at work, and the way that we dress, and let's have an ugly sweater party. But people often forget the holidays are very painful for many people, and it can bring up a lot of things that maybe you grew up with in a dysfunctional home, and every holiday was a guess, right? Or you never know what's really going to happen with dad when he starts having a couple cocktails, after dinner or something. So I just would caution us to just assume that everyone's so joyful, but essentially what we find is that we are always so run down doing all of these duties we think we have to do during the holidays. So now we're not on top of our coping game, right? Because we're run down, we're not taking care of ourselves, little self-care, maybe you're a caregiver, and you making sure all the things are in order for these holidays. And if you miss one thing, it's just going to destroy it for everybody. So you're already on heightened anxiety. And then, put on top of that potentially grief or trauma, things from the past. That is like a perfect recipe for a disaster for many people. So it's important to know, I think, going into the holidays, what our options are locally for not only yourself or your family, whoever you take care of.
Yeah, I want to just again emphasize and highlight and normalize how difficult this time of year is for folks. I was actually just looking at American Psychological Association did a poll pretty recently and found 9 out of 10 people, or approximately 89% of people, are stressed this time of year. That's like nearly everyone. Those are the people that said yes, that could be an underestimate. So I just want to normalize again that, TV and movies all paint this beautiful picture that everything's all cheery. Actually, majority of us really struggle this time of year. And for all the reasons Carrie mentioned, and I want to highlight a couple of them really, that sometimes, all of us deal with grief and loss, but I think that gets amplified around the holidays because you are getting together, or maybe you're seeing other folks get together and you're just remembering your loved ones. And perhaps this is the first year that you're without them, or perhaps it's been 10 years and, that pain doesn't go away. There's no timeline for grief. And so I think the holidays really do make this particularly challenging for those that have lost loved ones. I think the other thing too that Carrie mentioned that I fully believe is the holidays just pull for so much from us, right? It's like you gotta add on all of these extra things, these extra tasks, the shopping and the cooking and all of the things. And it can make us feel like we need to be doing all of these things. And we can kind of sometimes forget what's really important to us, like what's valuable to us. And so getting caught up in all of those like to-do list items instead of focusing on why don't I just kind of focus on spending time with the people that are important to me, or maybe engaging in some self-care because that's important too.
What does self-care look like to the two of you? Like, what would you characterize it? Because there's this whole like space around self-care and what that means. And it can be glamorous and it can be taking a minute. And I wonder if you talk a little bit about that.
I will jump in with my non-clinical hat. I'll be curious to see what Dr. O'Connor's going to say. But, I would recommend, as people go into the holidays, there are some things that you can hopefully anchor you, like maybe it's a schedule that you keep to. I know that you took the day off, but maybe you don't need to sleep until 11 a.m., right? Keeping the best schedule that you can to make your body feel that it's still in that same routine if you take off time. You're creating that healthy routine. And I love what Erin said about like maybe you don't have to do everything. But I think the people with the most beautiful tree and the most beautiful house, they got the most problems. Got a whole bare spot in the back
There's
of my
a
tree.
whole song related to that, right? More money, more problems. I don't disagree.
More money, more problems. So letting go of that, like our temptation to have FOMO or the fear of missing out when you're looking on the socials and you say, I don't do that to my home and I don't celebrate like that. I guess trying to stay out of that, trying to have some different techniques and tools for mindfulness, knowing when you have just kind of hit the wall and trying to stop before you get there. Just celebrating and appreciating is a little bit of self-love when there's small wins, right? Like you don't have to get everything right. You don't have to get that whole thing done. I guess that's where I'm from, but I do like to nap, and I'm pretty sure it's probably not a really good self-care habit, but I like it.
I think it sounds great. I don't know. I disagree. I think that sounds wonderful. I could take a nap.
I think you're in good company, Carrie. I think a lot of folks enjoy a good nap, especially those of us with young ones. But I want to add in and highlight Carrie mentioned mindfulness, and that's something that self-care is, again, not one size fits all. It's so personal to everyone. And so really reflecting on like what fills your cup up, what gives you energy in this season that drains so much of our energy. So that reflection I think is really helpful. But mindfulness really is a great way to engage in self-care. Mindfulness teaches us that we should try to remain present, right, in the current moment, as opposed to in the past, kind of worrying and ruminating about, gosh, what did I say? What did I do? What did I miss? Or the future, like, oh, what do I have to do still? Like, how's that going to go? So staying present in the moment, in the here and now, in today. Let me just try to be present today. That alone is powerful. And that really promotes great self-care. It tries to kind of keep us present, keep us engaged. And then we really maximize our benefit in what we're doing, in who we're interacting with, and, in what we're doing, what activities we're engaged in. So, and there's a lovely mindfulness-based exercise that I want to share with everybody today, hopefully before we end. It's something that I personally use when there's the chaos of everything, particularly the holiday season. And I think it really kind of highlights some of what Carrie was talking about too, with like, you don't have to be perfect. You don't have to do it all, and it all doesn't have to be perfect. And so it's this mindfulness exercise. You take a deep breath in and you say to yourself, breathing in, I do my best. Breathing out, I let go of the rest.
Oh, that's good.
That's wonderful. Thank you so much, Dr. O'Connor. Carrie, I want to give you one last, if you had any last things you want to leave the community with, I want to give you an opportunity, but you've left us with so much.
Really, really quickly, I want people to know that you're not alone. A lot of people go through this. Try to keep it isolated to the holidays, that stress. And the minute that new year comes, the quicker that you can get on a regimen or back to your old self, the better. But if that seems to spill over into the new year and you're still struggling with those feelings, get help. We're here to help. That's my only thing. Yeah.
Thank you both so much. This has been really, really wonderful. I want to leave us with a quick conversation or a quick message from Carolyn Lochner, who's going to talk to us a little bit about how she's engaging with the community to understand what resources around mental health we might need to think about and how we listen to the community. So I'll let you give more context. And Carolyn, thank you so much for being here and offering this opportunity for people.
Of course. Thank you all so much for having me. I will be very quick because I know we're low on time. I'm Carolyn Lochner. I'm an associate professor in the CS Mott Department of Public Health. I'm also co-director of what we're calling the Tech Initiative, the Technologies for Empowering Community Health Initiative. It's brand new. And really what we want to do is talk to our community and find out what their needs are and what their values are and what their desires are related to how we can use technology to support healthcare. We attended a community engagement session at the Michigan State campus recently, where we heard from a lot of people that there's a lot of interest in telemental health or technology for providing mental health services or mental health support, very broadly defined. And we want to know more about that. We want to know more from people about what their priorities are, how they think technology could facilitate mental health, any barriers to doing that. So we are inviting people to attend a community listening session at the Flint campus. There's a QR code on the slide. I saw Heather just put the link to the survey in the chat. We invite anybody who's interested in potentially attending this session. We're hoping to do it sometime in January after the holidays. We'll provide some food, we'll provide some drinks, and we'll hopefully have a good conversation. So if you're interested, please go ahead and go to this URL. It just asks you to give us your contact information so we can reach out to you to get something scheduled and to keep you posted. My email address is also there if you have any questions or want to talk about it some more. And we invite everybody to this. So community members, people working in the field of mental health, people who are interested in receiving mental health care, anybody. We want to hear all opinions and viewpoints. And that's all for me. Thank you.
Thank you so much. And as we end, I want to leave you with what Dr. G put in the chat. In the new year, I'm wishing you progress and not necessarily wishing for perfection. So thank you so much. Happy holidays. I hope you have all of the self-care thoughts you need. And I hope you are able to have a good holiday, and we will see you in the new year.